Hello, everyone, and welcome. My name is Rachel Walker, Customer Learning and Development Manager at Azalea Health, and I will serve as your moderator for today's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Everyone on this call is listening in using their computer audio system by default. If you would prefer to join over the phone, just select the telephone in the audio pane on the right-hand side of your screen, and the dial-in information will be displayed. You will have the opportunity to submit questions during today's webinar by typing into the questions pane of the attendee control panel. You may send in your questions at any time, and time permitting, we will address them during the Q&A session at the end of today's webinar. On today's call, we will hear from our premier patient intake partner, Phreesia. As the top-rated intake platform 4 years running, Phreesia understands how to help your organization create a better, more engaging healthcare experience for your patients and staff. So we thank you for joining us today, and with that, I will turn it over to our presenters, Andy Smith and Joey Demmons.
Thanks, Rachel. Just on behalf of Phreesia, I just want to quickly say thank you so much for having us, and thank you to everyone who's in attendance today. Our main goal for today is to really highlight how this a partnership between Phreesia and Azalea Health can help solve some of healthcare's biggest challenges. We'll give you a brief overview about Phreesia, walk through a brief overview on our new bidirectional API integration and the implications that it enables, and then actually talk about some of the challenges and opportunities facing rural healthcare organizations today. And then finally, we'll end with a brief Q&A. To kick off our introductions, I want to quickly just introduce myself. I'm Andy Smith. I'm the Director of Market Development at Phreesia for new markets. Based in New York City, my focus is to extend Phreesia's reach to new healthcare practices by partnering with leading PM and EHR organizations such as Azalea Health. Not only do I help manage the relationship with Azalea, but actually steer the dedicated cross-functional team that'll be with you in your evaluation of Phreesia from sale through implementation, servicing, and support throughout your entire customer experience. Prior to joining Phreesia, my experience is rooted in healthcare consulting and spent some time in health plan product development for large health systems deploying integrated care delivery models. I'm so thrilled to be with you today, and just again want to say thank you on behalf of Phreesia. Joey?
Yep. Hi, everybody. My name is Joey Demmons. I'm the incoming ambulatory product manager here at Azalea Health. And it's been my new role to help empower our ambulatory clients in order for them to be as efficient as possible and enable them to expand their patient care. I've been an IT professional for several years now, and I've kind of moved over internally. My prior role here was as the API application integration product manager, and so I've been very hands-on with this integration and planning and building it out. I've been working closely with Andy and Stacy and the integration team there, and we just hope to help deliver as much information today and try to answer as many questions as we can.
Awesome, thanks, Joey. So to start us off, a little bit about Phreesia. Phreesia is a SaaS or software as a service technology company with a mission rooted in creating a better, more engaging healthcare experience. Over the last 18 years as a market leader, we've expanded our network to all 50 states, become a publicly traded company, and have been recognized as top ranked by KLAS for patient intake management 4 years in a row. I'm thrilled that the next era of our development is partnering with Azalea Health to support Azalea patients and practices through a suite of applications, including online appointments and referral management, mobile and in-office registration, insurance verification and flexible payment options, as well as clinical support tools, targeted outreach tools to enhance patient activation, and a suite of analytics and reporting that allows business leaders to make informed decisions. So the problem on the screen is something that you're all familiar with and face every day. Ultimately, healthcare continues to have among the highest number of job openings compared to other sectors. And the shortages are even more pronounced in rural areas. I know that you know this better than even I, but in the face of such a crisis, one of the solutions is actually turning to technology. For groups who have hired Phreesia to save staff time and create a better patient experience, they've seen on average around 8 hours of time saved for every 100 patients that check in. That's essentially adding another team member or another staff member The icons below basically outline some of the tasks that we can automate so that you can remove some of the redundancy from your day-to-day and focus more on patients and the high-touch, communication that they deserve. Phreesia is committed to meeting patients where they are. The vast majority of patients will engage with the Phreesia platform through their mobile device using their web browser. Unfortunately for them, they don't have to use an application or remember credentials, including a username and password. Instead, each patient is actually sent a customized registration link through email or text message that kicks off their patient registration and check-in experience. We also understand that for a lot of practices, having a hardware solution in office is crucial. Although we have our legacy hardware, which we call Phreesia Pads, we also have a new solution called PadX, which basically takes any investment you've made previously in iPads and actually enables them to be functional with Phreesia. And then finally, the dashboard for practice staff is really the hub for all patient activity as they go through their registration and check-in process. Staff can actually monitor their progress and are alerted to any elements that need staff intervention or require additional attention from the team. What I'm most proud of is that Phreesia actually drives a true return on investment. For practices across their network, this is just a couple of the areas that we can drive value, but we see up to 5 minutes of staff time saved for every patient that checks in using Phreesia. From a clinical perspective, 97% of patients who are prompted with a clinical screener will complete it. That's essentially doubling the number of screeners that you collect. And then finally, for maximizing profitability for each practice, we see on average a 2x increase in time of service collections when collected through Phreesia rather than staff. We know those conversations are exceptionally difficult for staff to have, and instead we take the burden away from them and allow patients to make those tough financial decisions from the comfort of their home on their own time while still maximizing collections. I'm thrilled to say both of our organizations are mutually aligned in our commitment to enhance the intake experience, and both of our organizations are dedicated to better engaging patients, expanding access, and improving health outcomes. This is from the across our organizations and all the way to the top. As you can see, both our CEOs agree. Joey, anything you want to add on this slide?
Sure. If anything, I can just add that both of these companies are so closely aligned in the goal that we have for improving patient care and profitability for our clients, and just really having this aligned at the top down really helps this, even just down to the integration level. And so working with Phreesia has just been amazing. I will probably have a hard time in not saying nice things about this team, but just know that this alignment really helps us to deliver the best possible product that we can.
Thanks, that's awesome. Couldn't agree more, and we're thrilled to be your premier intake solution. It's been a pleasure working with this team thus far, and there's so much more that we can accomplish. So this is certainly by no means a complete representation of everything or every touch point that a patient will have within Phreesia, but it really does help to see throughout the patient engagement journey, how can Phreesia potentially impact a patient's experience? So before their first visit, a patient can actually request an appointment through an online form. They'll receive appointment reminders leading up to their actual appointment. And as I mentioned before, we'll receive a customized pre-visit registration link with a registration and check-in experience that is logic-driven and customized by provider type, by appointment type, and a variety of other factors to really hone in on what information needs to be collected from a specific patient. Next, during the visit, let's say a patient doesn't actually have the chance to complete their pre-visit workflow, staff is able to push a registration link to their mobile device or a tablet, for example, in office directly from the dashboard. In addition, we present a variety of time service payment options, including payment plans, payment assurance, and present outstanding balances to maximize collections. We're able to increase the overall collection of patient-reported outcomes, which help drive overall health outcomes across the practice. And if a specific practice is promoting ancillary service, there's actually a forum to be able to do that as well. After the visit, We are able to present a variety of post-visit payment options, including payment reminders through text and email. And what I think is especially important are patient satisfaction surveys, which not only assess their experience with the practice, but their experience with Phreesia, so that you know that this solution is driving value and is being well received by your patients. And then finally, what's probably most important and probably the most overlooked is the time in between visits. Through our communications platform, which includes broadcast announcements, automated recall messages, and targeted email outreach, we can connect you with subsets of your patient population who are potentially at risk or represent a unique medical need, to have an ongoing touch point and communication system that's engaging and brings patients back to the practice on a regular basis, closing gaps in care. Finally, I'll pivot to how we want to try and create a high quality, convenient experience for rural patients. The first step is to remove the notion that rural patients won't use technology. Phreesia actually recently had a webinar in which we invited Dr. Gerald Harmon, who's a rural family MD and the immediate past president of the American Medical Association, who described this notion as a systemic problem and structural myth in healthcare. And Phreesia has actually been able to validate that claim through our own research, where we determined that rural patients have equal access to internet and use the internet in the same frequency, and are just as likely to have a smartphone as someone in a more urban environment. Instead, our focus should be on breaking down barriers and offering tools that don't require users to log in or use an app and are familiar to the patient, such as email and text. Finally, we also want to deploy a train the trainer model. With all of this extended staff time, we actually can free up staff to have more high-touch conversations with patients who require additional attention. Ultimately, we're working towards making the most of a patient's time in the doctor's office. As we know, urban patients are often subject to health disparities and various social determinants of health, including transportation and overall access to care. By creating a more flexible and convenient experience, offering mobile check-in and converting visits to telehealth, we can make healthcare more accessible for patients regardless of their geographic area. And finally, the ultimate goal is to advance health equity by engaging rural healthcare patients actually in their care, throughout their care as well. So for automated appointment reminders, educational outreach, and pre-visit screening, we can make the conversations in the exam room far more effective and allow clinicians to build trust with patients, ultimately with the goal of increasing their confidence to come back to the same provider and increase your keepage or the likelihood of their return. I will hand it back over to Rachel to enter into our Q&A session.
Thank you, Andy. So we are now going to begin answering questions submitted during today's presentation. As a reminder, you can still submit questions in the pane in your attendee control panel. But I will go ahead and kick us off with the very first question, which is directed to both of you guys. So our first question received is, why is intake such an important area of focus for both Phreesia and Azalea?
Yeah, I'm happy to jump in. So candidly, intake is really the first impression for a lot of patients. There's a lot of mistrust in healthcare, that it's expensive, that it's inaccessible. So for small independent healthcare practices, all the way to the largest hospitals and health systems, intake is really the first impression and the representation of a brand. That contributes to the concept I just mentioned, which is keepage, or their likelihood of becoming a return patient, and building trust to actually have effective care. Intake really extends our reach into having a constant touch point with patients rather than just when they're in the office. And that's really valuable, not only just from building trust, but also for improving health outcomes across the board.
Yeah, thanks, Andy. I'll chime in as well. I wholeheartedly agree with Andy's response on that. Patient intake, that is the first chance most patients get to have an impression made by a facility. And really, Phreesia just gives one of the best impressions to those patients. Them being able to streamline this workflow and make it easy and accessible is hugely beneficial for both patients and our clients alike. And it really helps just deliver a better overall experience. Patients are able to quickly, get through the tasks that they would normally have to do sitting inside of an office. Now with Phreesia, they're able to, maybe do that from the privacy of their own home or just in the car before they even hop into the office. And we know that has been beneficial for a lot of people. And so really this Phreesia intake system is allowing us to really be able to branch out to more patients more effectively.
Awesome.
Thank you, Joey. The next question is directed to you as well, Joey, and it is, why has Azalea chosen to work with Phreesia?
Azalea Health has chosen to work with Phreesia first and foremost because they have the best track record. Phreesia stands out in the list of intake solutions, and they've reached out to us for starting this integration, and we like what we see. It's a very solid solution, and it's something that we believe in, that we've put a lot of time and effort into completing, and it's something that we can believe in as a company.
Thank you. The next question could be for either of you, but Andy, I will ask you, how
Sure.
long is the implementation process with Phreesia?
Yeah, so we typically estimate around 8 to 10 weeks for implementation to bring groups live. It ultimately varies on a client-to-client basis because we candidly don't treat any two organizations the same. We will actually have a dedicated team who's responsible for each implementation, and they will interview each practice, assess their unique needs, assess their unique workflow needs, and actually build in custom logic that makes the Phreesia intake experience what they want it to be for their practice. There's no one-size-fits-all approach, but we can typically get that done in around 8 to 10 weeks.
Thank you.
Sure.
Joey, this next question is for you. Is the Phreesia integration only available for Azalea Ambulatory, or is it available for the hospital platform as well?
The integration is currently only available for our ambulatory application and our customers there. We are working and looking into expanding that for hospital operations. And there will be kind of more to come very soon, we hope.
Yeah, I will say if there are hospital clients out there who have ambulatory practices within their umbrella and are on the ambulatory practice, we're happy in the meantime to sort of assess the land and expand so they can establish best practices and get really comfortable with Phreesia before deploying a more enterprise-wide strategy. It can be a really effective approach to deploying the solution, but yes, as Joey mentioned, it's only compatible with the ambulatory platform today.
Thank you both. Andy, I have another question for you.
Sure.
How can these types of tools help rural practices more effectively engage patients and address health disparities?
Yeah, I mean, we really can't understate the impact of some of these health disparities in rural environments. Candidly, it takes a really robust effort to try and engage patients, and I think that's one of the most important things is having touch points throughout the entire patient journey, from the pre-visit all the way through after. And I think our communications platform is really powerful in trying to reach patients across modalities, in different techniques as far as whether it's a recall or a targeted campaign to try and get them. It really enables practices to dig into subsets of their patient population and get them back to the provider. And then when actually they're seeing the provider, we're maximizing the amount of data that's collected and making it really easy to complete screeners and assess their actual needs because it's in such a more friendly, engaging mode than traditional clipboard or a long intake packet that they have to download themselves prior, off a website and print and all of that. So it really meets them where they are, and I think that's what's really powerful in driving health outcomes.
Thank you. Another question received that could be for either one of you is how, if a customer is interested in a demonstration, who should they reach out to?
Sure. So I'm going to just quickly share my screen so everyone can kind of write this down if that's okay. Let me know if this comes through. But we've actually built a website for you all to be able to submit. Is this just me want to make sure this is coming through?
It is. We're able
Okay,
to see.
awesome. So that link down at the bottom, phreesia.com/Azalea Health, is carved out for you to learn more about Phreesia. And there's actually a demo request form built into the website, which will get routed and you'll receive outreach from one of our sales team very quickly to sort of assess your needs and put together a custom demonstration for you all to see the nitty gritty of Phreesia.
Perfect.
Bear with one more second to write that down. Cool.
And we have also received a question that is directed towards you, Andy, and that is, which Phreesia product or functionality are you most excited about that you haven't talked about today?
I think we haven't really talked about patient chat, which is something that's very simple but very powerful. So it's a two-way chat exchange, which makes day-to-day operations and communications with patients really, really effective. So much so that during the pandemic, we were actually able to deploy no contact waiting rooms with groups waiting in the parking lot until they were ready to actually have the patient walk into the waiting room. So there's a ton of applications for how we can actually leverage text, and it's really the communication modality that people are most comfortable with today. And so it just makes the doctor and the healthcare experience so much more accessible overall.
Thank you. We've received another follow-up question from the audience, and this customer in particular already has a patient review platform in place. So they're asking, how would the patient satisfaction component affect this?
They have a surveys tool. Is that what we're getting at? I apologize.
Yes, that's what I'm gathering.
Yeah. So obviously we'll work with you to try and if that's the service that you want to use. We'll be able to communicate with them to complete those surveys, so we can use more of a communication approach to actually send them to complete their surveys. Our patient survey platform also links to a couple of very common patient review sites, Google reviews, I think Yelp, and perhaps Facebook. Apologies but we'll actually be able to present those icons that can link out. So whatever is most important for you, that's customizable, and we'll work with you very hands-on to say, how do you collect reviews and what's most important, which service is more important. So it doesn't have to be a full replacement in that regard. There's some strategies we can deploy.
Got it. Thank you so much, Andy.
Sure.
Okay, we've received a question that both of you guys would be able to help with, and that's that many organizations have been impacted by staffing changes. How does a partnership with Phreesia help solve for that?
Yeah, so we talked a little bit about the ability to automate some repeatable processes through Phreesia. But one of the other things I want to highlight is actually preventing staff burnout, which, the larger picture of the macro environment of having it be hard to hire and stuff, that's oftentimes out of our control in the bigger picture. But what we can do is make employees' lives easier. And I've seen firsthand how the impact of Phreesia and technology overall can really help prevent burnout and retain your top talent. Again, it's hard to hire new people, but this is something we can actually tackle right now and something that can be impacted very quickly.
Yeah, and if I could just add one item, I think part of that might also be aided by just the intuitiveness, right? And being an easy system to learn and to understand and to quickly be able to ramp up and get a full staff running and utilizing the Phreesia dashboard. I see that as a big win.
Thank you, Beth. We'll give everyone just a few more minutes to submit any follow-up questions. We're almost at time, but one final question I do have for both of you is, what excites you most about the future of this integration and partnership?
Yeah, Joey, do you want to go first?
Sure. Yeah, I'll tackle that. What excites me most is honestly the possibilities. Right, we're building this integration with the current scope that we have, but fortunately, the framework that it's built on is expandable. So, you know, we aren't restricted to only what we are delivering today or what we have planned for delivering in the clinical reconciliation workflows. Right, if there's something that is pointed out as this is something that needs to be addressed, can you help us with X, Y, and Z? We can take that approach. It's something that we can investigate. We can see if that is in fact something that can be accommodated through this integration, and it really does leave a lot of opportunity to meet and satisfy demands and issues that clients might have.
I couldn't agree more. I'm so excited by the fact that we're just getting started and the product we're able to put forward is really fantastic, but it also represents a moment in time. This is going to continue to change and evolve, and just based off the conversations I've had with some of our early adopter customers, we're learning so much, and we want that to continue to be a true partnership in tweaking this solution to be really relevant for Azalea practices. I think both our organizations are really product driven, and speaking from Phreesia's point of view, we want to make great product, and we really don't treat any two practices the same. Azalea has been a great partner in helping us build an integration that allows us to deploy that level of customization, and that's really crucial for us going forward. So it's really exciting.
And we've received an additional question from the audience, and that is, can the pre-registration information be customized as well as consent forms?
Yes, this is the bread and butter of Phreesia, is creating a customized check-in experience, and as well as your custom consents and forms. We'll work with you directly. I'd love, this is a great opportunity for whoever asked us to submit a request for a demo so we can have a really specific conversation to you all. But the answer is absolutely yes. It's not just what questions. We can make certain things mandatory, not mandatory, put logic-driven responses in that ask follow-up questions. We can do expedited workflows for walk-ins, things like that. There's so much that we can do to meet your needs. I couldn't possibly cover it in an hour, let alone this 30-minute session. So it's we definitely want to have a specific conversation with you directly and learn about what you're hoping to achieve. But the short answer is yes, absolutely.
Thank you, Andy. And we are now at the end of our time, so we'll be concluding today's webinar. Any questions submitted that we did not have time to get to live will be addressed following today's call via email. We want to thank everyone for attending today's webinar, and a special thanks to our partner Phreesia and Andy. As a reminder, a recording of the webinar will be shared via email in case anyone wants to review it again or share with any of your providers or peers. You can connect and learn more information about this partnership by visiting phreesia.com/Azalea Health. And on behalf of Azalea Health and our Phreesia presenters, we thank you for joining us, and we hope you have a great rest of your day.
Thank you all so much. Appreciate it.
Yep. Thank you, everybody. Take care.
Bye, everyone.